Hello. I will be conducting this interview. Uh, can I have your full name?
My name is Juana Rodriguez.
Okay, Juana Rodriguez. What's your job title?
I am a nurse and I work as a nurse in a home health settings. So I see the patients at home.
Okay, and how many years have you been in this profession?
I have been in this profession more than 2 years now.
More than 2 years. Okay. Good. What experiences or knowledge is required to do your job?
Other than the knowledge of a nurse that you have to be a nurse in this country and everywhere, so you have to have experience treating people at home, where it's a setting where you are alone with them, and you have to be able to solve any problem that appear without any help or anything. So it's a challenge to to develop our job in this condition.
Okay. Okay. Um, does your job require overtime, and what is your work schedule?
Um, there is normally it does not require overtime, but if we have to do any IV infusion or something, we have to have the schedule of the IV of the patient. So sometimes we have to work at night. Sometimes we have to work at 6 o'clock in the morning, and we don't have any fixed schedule. It depends on the number of patients and the, the condition of the patient that we have.
Okay, what is the typical entry level salary range for the field?
It depends on the patient that we see, and for example, it depends on what do we do. If we do a sign up of the patient, we will make for example, $60 an hour. But if it is a follow up, it will be 35 to $40 an hour, and it depends how many patients do you have. If you have, let us say, 6 patients in a day that is a sign up, then you know that you will make a 65 for multiply by 6. So
Okay. 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 What is the biggest challenge you encounter?
sometimes is to be to have the rapport with the patient itself. Sometimes the patient at home are difficult to deal with, and but the most difficult challenge we find is when there is a big wound that needs negative pressure treatment is a challenge for us to develop that kind of job.
Okay. Yeah, I'm sure it's an emotional toll too. It's pretty
Yeah,
pessimistic.
absolutely.
Um, what advice would you give someone thinking about this career?
Now, thinking about career, first of all, you have to be patient. You have to be compassionate. You have to work with a person that are sometimes you know that they will die immediately. So you have to be strong enough to affront difficulties like that, and you have to like this kind of job.
Okay. Is there anything you can say to me about physical therapy?
Physical therapy is it's a very good job. It's a very important job because most of the elderly people need physical therapy, and it's a tremendous way to keep them in a good shape, working properly, walking properly, and without pain. It's very good for people that have joint pains and things like that. And it's a very compassionate job also, and it's a very well paid job, by the
Okay,
way.
that's good. All right. Have you worked with a lot of physical therapists? before, or
Yes, I have
conversated with a
worked,
lot and
I have seen,
connected with them?
yes, I have had a connection with multiple physical therapists because we have to work together. We have to open the case and then to give the physical therapy an idea how is the patient health. Because, for example, if the patient has a very high blood pressure, the physical therapy cannot go and provide
Yeah.
the service in that moment
Yeah, of
because
course.
the patient have to be better. So we work together and there is a very good connection. I have seen and I have been impressed for a lot of physical therapists with the job that they develop.
Okay. Well, thank you very much. It was a pleasure.
You're welcome.
Thank you.